Hello friends. So today on 17th November we actually celebrate this day as a National Epilepsy Day. This day was created to increase the awareness about the epilepsy in general public, so that they should know what it is, whether it's treatable or not, and how to do the management of this epilepsy. Now, the epilepsy is a chronic disease or acute disease in which patient will have multiple episodes of seizures, fits. It occurs because of the electrical stimulation inside the brain of the neurons, mainly the neurons. It is the sudden outburst of the neurons which causes the seizures. Now, if we see that as per the WHO status, around 50 million people is suffering from the epilepsy all over the world, and most around 80% of the patients are in developing countries. Now, the main issue is that patients or the individuals, they don't know about the epilepsy. If they are having, they don't know whether this is epilepsy or not, and because of that, most of the patient, mainly in the developing countries, is not getting the treatment for epilepsy. And in India, around 10 million people are suffering from epilepsy, and maybe many more. Now, what is actually epilepsy and what are the symptoms that you should know, so that you can diagnose that somebody, your near one or dear one, is suffering from this epilepsy. In the symptoms is mainly it may be just a twitching of one part of the body, maybe the face or the limb, or upper limb, or the hands or the legs. The patient can have a loss of consciousness. Patient can have a stiffening of the upper limbs as well as the lower limbs, and there are sometimes only the sensory component, like patient will have some abnormal sensation in the form of tingling sensation, some abnormal sensation that patient can feel on one part of the body or whole part of the body. Now, what is the main cause of this epilepsy actually? So there are a lot of causes. It will start from the type at the time of birth, like patient can have during the perinatal area, during the birth, the child can have some injury, birth injury. Because of that also patient can have seizures. Then some brain abnormalities, congenital abnormality inside the brain, because of that also, like trauma, infection in brain tumors. Patient who has suffered from stroke, like ischemic stroke or the hemorrhage, and a lot of condition. There are some small part which is what we call it genetic, in which epilepsy runs in the families, but this part is not very much. It's very small quantity of patients who is having a familial seizures. Now, what you can do, like if a patient is having a epilepsy in front of you, then what you should do? The first thing is that you should not panic. First of all, just see whether a patient who is having a seizure, ongoing seizure, just see that nearby is there any dangerous object. If it is there, that you should remove. Try to make the person on one side, so that whatever the saliva or whatever in his mouth or her mouth, he should not or she should not aspirate. Then you should remain steady. Do not resist the movements of the individual seizures, and just stay calm and remain with the patient. If possible, put something below the head, maybe a pillow, to protect him from any injury. And do not put anything in the mouth of the patient during the act of seizures, neither your fingers or any food. And just call the ambulance if possible, or the any healthcare personnel, so that they can manage the seizures. As you know that this epilepsy is main issue is the awareness. So how to aware the people? You have to understand the symptoms of the epilepsy, and you can read also from various journals, in TVs. We use like social medias. In all these platforms, a lot of information is there. So what we need in India is that the individuals or the people should know that what is epilepsy. And there is a myth with many of us that these epilepsies are not treatable and they will go lifelong. It's not like that. We have seen a lot of patients, around 75% of patients managed medically, and they almost 100% cure is there with the medication if you take for a particular duration. At the end, I just want to give some tips to those patients, mainly the epileptic patients. The first thing is that you should not stop your medication. You have to take your medication as per the doctors. Take regular advice of your doctors, even if you are totally well with the medication. And if you have any other condition, we see seasonal patient can have a fever, person can have a fever, and they used to take these medication, antibiotics. It is always important to inform your treating doctor that you are suffering from epilepsy and you are taking these treatment. And the third point is that you should not indulge in any abuse like alcohol or any other type of tobacco chewing or smoking like that. So it's very important that you should refrain from these precipitating factors and take your medication properly. The only message which I can give to all of you is that do not panic, do not afraid of seizures. If you find anything what I have just now explained, you should always think that maybe it's a seizures, and go for nearby any general physician, or just consult a neurologist or any other physician, so that this epilepsy can be managed and a person can have a fruitful life. Thank you.